morning, everyone. Before we begin, I'd like to introduce our organization, Volunteering for Seniors. We are dedicated to supporting seniors through a variety of engaging programs and workshops that focus on health, wellness, and community involvement. One of the ways we do this is by hosting informative webinars like today's session on Medicare open enrollment. These webinars are designed to help seniors and their families make well-informed decisions about their healthcare. I'm thrilled to welcome you all to today's session, where we will focus on one of the most important periods for Medicare beneficiaries, the open enrollment period. We are fortunate to have a very special guest with us today, Kathleen Chinca, who is the Regional Director for SHINE, serving the health insurance needs of everyone. Kathleen brings a wealth of expertise in helping individuals navigate the complexities of Medicare. She leads a dedicated team that provides free, unbiased counseling on health insurance options, including Medicare. So Kathleen's insights will be invaluable as she guides us through the steps of how to review, compare, and select the best Medicare plans during this critical open enrollment period. Her guidance will help ensure that everyone can make informed decisions and get the most out of their Medicare benefits. Before we get started, I'd like to let everyone know that today's session is being recorded. We will be sharing the recording with all of you shortly after the webinar, so you will have access to revisit Kathleen's valuable insights. Without further ado, it's my pleasure to invite again Kathleen Chinca, our Regional SHINE Director, to take today's stage and guide us through how to make the most of Medicare open enrollment. Kathleen, the floor is yours.
Thank you, Pratima. I'm just going to say hello to everybody. Good morning. And I have a list of questions that Pratima has given me a little heads up on that are out there. And as I go through my presentation slides, I will try to address those specific questions on the appropriate slide. The slide will be available. I have sent it to Pratima. If you want to get a copy of that, she can forward it along. I don't have any issue with that, except on one particular page, and when I get to it, I'll spell it out. The numbers have not been updated for 2025. I don't have those available to me. So what I'm going to do is click onto the share screen right now and go through the slides, okay?
Thank you, Kathleen.
Okay. So, and they look okay to everybody out there? Okay, so this is the slide presentation that's been prepared at the state level for the Medicare open enrollment for 2024. Many of you, if you're already on Medicare, have gone through some of these steps already. So I'm going to go page by page and then explain the page. And if there's no specific question that I've already gotten from Pratima on that page, I will just keep going forward. So if we could go to the next page, Pratima, I'd appreciate that. As Pratima said in the opening interview, SHINE is the acronym for serving the health insurance needs of everybody. And that is people on Medicare, whether you have aged into the system at age 65 and through your working years, or you've been disabled for more than 24 months and you've had credits within the Social Security, you would be put on Medicare automatically based on 24 months of Social Security disability. And the SHINE program is here to educate people, both individuals, consumers, professionals that work in the field, as well as community organizations to help their consumers navigate through the confusing and chaotic world of Medicare, and in conjunction with how it works with Social Security and other public benefits, okay? The public benefits that cover the health insurance is the program, the federal program is called Medicaid. Massachusetts Medicaid program is called Mass Health. All right. So sometimes people are eligible for both, but unless we have specific questions, I'm going to ask Pratima to go down to the next screen. Okay.
Here's done. Yeah.
I'm already down. What SHINE does.
Okay. SHINE, and I've done that. So the public, yeah, I've done that. So let's go to the next screen. Page 4. Yeah, slide 4.
1 second. I don't know what's happening.
Yeah. Technology. Okay. Medicare 101. If this audience right now is already on Medicare, you can maybe just go get yourself a cup of coffee. It's not anything that you haven't learned already. But for anybody who is thinking about retiring soon and going on Medicare, pay attention to this slide. There are 3 different parts of Medicare. And in order to enroll in Medicare, it doesn't sound like a good process, but you have to enroll in Medicare through Social Security. I want to just clarify that you do not have to enroll in Social Security benefits at the same time. Those are 2 separate things, but you do enroll in Medicare through Social Security. Medicare Part A is hospital coverage. And for most people, that hospital coverage is no additional cost once you enroll in Medicare, because if you've put in your 10 quarters, your 40 quarters or 10 years into Social Security, you have actually prepaid that by your payroll taxes. When you see on your pay stub and Medicare payment, that's what you're doing. You're prepaying your hospital coverage. So for most individuals, there's no additional cost once you start enrolling in Medicare. Part B is medical coverage, and it's also durable equipment such as canes and wheelchairs and that sort of thing. We'll go deeper into that if needed. But Part B is something that you pay a monthly premium for. Currently, the base premium is $174.70 at a minimum. It is also subject to what they call an IRMA, which is income-related monthly adjustment, based on household income from 2 years prior to enrolling in Medicare. If you do find that you are subject to an IRMA and your life circumstances have changed since that 2-year look back, you can apply for an appeal so that a SHINE counselor can help you with that. Social Security is the only one that can tell you if and what your IRMA adjustment may be. That Part B premium is subject to change each year. We have yet, at this date on October 20th, have yet been made aware of what the Part B premium minimum is going to be in 2025. So with Part A, if you have Medicare Part A and you are hospitalized, there is a Part A deductible. Again, in this year, 2024, it's $1,632 based on between every 60 days if you are hospitalized on multiple occasions. I don't know what that premium is going to be again for 2020. Medicare Part B has an annual out-of-pocket deductible currently of $240, and the assumption is that it will be raised a bit for 2025, yet you're going to have to stay tuned. The information is not quite available at this point. And the other part of Medicare is prescription coverage, or Part D. I cannot tell you at this point in time, unless I'm looking at your specific Medicare account and your specific drugs and medicines, what your cost and coverage will be. That is totally individualized by somebody's medicines that they take, their prescriptions. And it takes a SHINE counselor a while to get all that information into the Medicare, what they call the plan finder, to find out which particular prescription plan is going to be suitable for each individual's need. So I don't have any average costs because it's all based on individual medicines. Part C, as you hear, there is really no what they call Part C in Medicare. It is the combination of Part A and Part B and D. Those are individual private insurance companies that sell a plan. It is really just an umbrella. You are no longer considered a true Medicare recipient if you enroll in a Medicare Advantage plan. You are now under the direction of the insurance company, their networks, their providers, their costs, and their copays. Again, that takes a lot of individual attention to determine what, if any, of the Medicare Advantage plans might be suitable for any individual's needs. So without going any further into that, okay, Medicare eligibility, and there were a couple of questions about Medicare eligibility. Individuals age 65 or older who are U.S. citizens or have met the legal residency requirements, and I believe currently that legal residency requirement is 5 years. If you work 40 quarters through your payroll tax, as I had mentioned before, you're entitled to the premium-free Part A. Or if a spouse or an ex-spouse, if the marriage lasted more than 10 years, you certainly could be eligible using that incentive. If you're under 65, as I mentioned, it's 24 months of receiving Social Security disability that would enroll you in Medicare under the age of 65. Medicare Part A and Part B are all determined the eligibility, as I had said earlier, through the Social Security Administration. Okay. Can we go to the next one, Fatima? For anybody who is considering retirement, and there was a question about that, there are certain enrollment periods. If you are working and you are covered by a group health insurance, if the employer has less as 20 or more employees, there is really nothing that you have to do at age 65. You could, if you wanted to, start the process and enroll in Medicare Part A only. There's no cost. You would be issued your Medicare number. And should something happen with your employment in sooner rather than later, all you would have to do at that point is enroll in Medicare Part B to pick up your health insurance. So you have 7 months around your 65th birthday should you decide to enroll in Medicare. That's the 3 months before, the month of your birthday, and the 3 months after, okay? And then you would have, that's to enroll in Medicare. If you missed your initial enrollment period, you would have to wait for what they call the general enrollment. So the general enrollment is January through March. So if you should have signed up for Medicare, let's say by September of 2024, and you missed your 7-month window, you would have to wait until January to pick up and enroll in the Medicare Part A and or B if you missed it. If you joined during the month of April, it would start on January, excuse me. It would start on February. If you enrolled in February, it would start in March. If you enrolled in March, it would start on April. And if you missed your general enrollment period, you would have to wait until the next following year for the general enrollment period to come again. Now, if you miss the Medicare enrollment, if you have group coverage, you're still all set. But if you don't have group coverage, it's going to be very difficult for you to pick up health insurance. So please pay attention to that enrollment period. There's also another enrollment period if you have already joined one of those Medicare Advantage plans that I spoke of earlier. And if you don't particularly care for that one and you want to change, you have the month of January, February, and March to change plan, to go to another Medicare Advantage, or to re-enroll as an original Medicare recipient and pick a Part D plan at that point. There are qualifying events if you're in a particular plan and you move out of the area, because many of them are area zip code related, that gives you a qualifying event to change your plan. And again, that's something that doesn't happen quite often, but it is available to make a change. So you don't have to be concerned moving out of an area that you're going to lose any coverage. You do have a special enrollment period to change plans. And then what we're in right now is open enrollment. Between October 15th and December 7th, you have anybody on Medicare can change their particular plan, their drug plan, their Medicare Advantage plan, re-enroll in original Medicare. There's any number of things that you can do during this window of opportunity, October 15th to December 7th, okay? We didn't have any questions on particular of that, so we can go on to the next slide, Pratima. I don't think we need to go into this. If anybody's looking for any further information, this clearly defines that initial enrollment period, but this is, if we don't have any particular questions on that, I think that we can go on to the next question, the next slide. Okay, there are just some things that there's a lot of communication between individuals about Medicare and about Social Security. And I just want to let you know that Medicare will not remind you that it's time to enroll when you turn 65, unless you are already collecting a Social Security benefit. So if you took your Social Security retirement benefit at age 62 or 63, you will then because they already know you're turning 65, they will enroll you. Or, as we said earlier, if you're collecting a Social Security disability check, again, they will enroll you automatically after 24 months. Reiterate again, it's Social Security that you need to call or go onto their website to enroll in either the Medicare and or your Social Security retirement benefit. That is the website. What I do, even though that 800 number is the national number, I would recommend anybody to contact their local Social Security office, because that 800 number, if you call that number and then you have an issue while you're waiting for any follow-up, nobody really knows in the great abyss of Social Security where your message is. So go to your local Social Security office, and SHINE has a list of all the Social Security office in the area, phone numbers and addresses. If anybody needs that, we could provide that if necessary, okay? This is where you see the highlighted areas. These are the numbers that I had mentioned earlier. These are the 2024 numbers that have yet to come down with the 2025. The deductible for hospital coverage is $1,632. And I think it only went up by about $4 last year, but I have no crystal ball to see what might be happening in 2025. So please pay attention. These are not accurate 2025 numbers. The Part D premiums, those are correct. So as we mentioned earlier, the Part D, which is the prescription plan, is based on somebody's medicines. These are the premiums. I believe there's 24 different Medicare Part D plans that are going to be available in Massachusetts in 2025. The least expensive will be $12.40, and the most expensive is going to be $190.80. Those plans are specific to whatever somebody's medicines are. So please, if you have any questions or concerns, please contact the SHINE office and we can help you mitigate the Part D plan finder and any questions that you might have. There's a specific form that we have, and we'll certainly send it out and get it back, and we will go through it all with you before you make the decisions. And also, can we go back one more? Yeah, back to that. That number that you see there, that when I had mentioned earlier that the Part B premium could be higher, called the IRMA, income related monthly adjustment. If an individual's income exceeds the 103, thousand or a couple exceeds 206, then you'd be subject to review for IRMA. And it can get very expensive based on, there's 5 or 6 tiers of income for each time it goes up. So again, Social Security is the only place that can tell you what your IRMA adjustment's going to be. That's not something a SHINE counselor can figure out, okay? We can go to the next slide. These are, again, this is a printout that you could have if and when you do enroll in Medicare. These are just a list of the preventive benefits that are just covered by Medicare. There's no additional cost for these things. These are just all preventive benefits, okay? They're not subject to deductibles or copays, no matter what type of coverage you have, okay? Fatima, we can go. Okay, this is where I want people to pay plenty of attention, because if you miss those that initial enrollment period that we mentioned a few slides ago, and you don't sign up for either Part B or D within a certain time frame, they are subject to penalties. And I cannot tell you what the penalty is, and it's a lifetime penalty. There's an average of about between 30 and 33 cents a month added to your premium. In this previous slide, we saw that the least expensive Medicare Part D plan was $12.40 in 2025. So if you had waited 24 months to sign up and you enrolled in that $12.40 plan, you would be paying a penalty of 33 cents a month times 24 months added to your premium. And that would be a lifetime penalty for not having signed up. And you only have, once you sign up for Medicare Part A and B, you only have 63 days to pick your prescription plan. So it's very important, that all of these little things click, that you follow the processes that are in place, because it can get very expensive if you don't meet these deadlines. And same thing for Medicare Part B. And a lot of us feel like, why should I pay $175 a month for something that I don't need? I'm not sick. I'm healthy. Why should I be paying for something that I don't need? This would be why. And I'm going on the assumption, again, it's only my own personal theory, that people buy these things when they need it. So they've got to build up a pot of money to help people who need it and who don't have it. And again, it's only my personal decision as to why they do it. But there is a lifetime penalty, and it can be very expensive. Again, lifetime penalty. All right. Same thing. We don't have to go. And that's the premiums. 12% for every 12 months, 10% for every 12 months that you did not enroll can get expensive, and 1% for every month that you didn't enroll in the prescription plan. And I know that average monthly cost is between 30 and 33 cents right now. I don't know what the average cost is for the Part B late enrollment penalty. All right. This is a handy little chart for people to understand that there are 2 ways to cover their Medicare. If you go with original Medicare, that includes Part A, which in most cases is prepaid. Part B right now we know is $174.70, and then you add prescription coverage at whatever cost, and again, it's individualized, so I can't project. And then you need to add, if you prefer, to cover that 20. Medicare pays 80% of their approved charges. The consumer is on the hook for the remaining 20%. So you can supplement that by adding what they call Medigap policy. And I'm going to note one of the questions that was given to me was about traveling outside. Medicare itself does not cover outside of the country coverage, but there are some of the Medigap policies, again, review with the SHINE counselor, Some of those Medigap policies do cover outside the country travel. Again, individual case, we'd have to look at the whole thing, but Medicare itself covers, if you're on Medicare, 99% of all doctors within the country accept Medicare. It's the outside travel that can cause a little trouble. Medicare itself doesn't cover outside the country, but some of the Medigap does. So that, in my opinion, okay, is what I refer to as Cadillac coverage. You cannot really do much better than that in getting full coverage where you can put your head down on the pillow at night and not worry about out-of-pocket costs. It's fixed cost. I'm not saying it's cheap, but it might cost you. And one of the questions here was, how much is it going to cost? So right here, part A would be zero at this point. Part B, we're going to go on the assumption that it's the minimum $175. Part D, I'm just going to use the $12.40 premium. All right, so now we've got almost $200. The Medigap coverage is about $200. So your out-of-pocket fixed monthly cost would be roughly $400. That is not including somebody might be on very expensive meds. So this is just a basic. So you can actually, if you don't take a lot of medicines, think full coverage on Medicare, roughly $400 a month. Okay. And you would be covered for the out-of-pocket cost. You'd have very, very minimal out-of-pocket cost. The alternative to going on original Medicare in with those four pieces combined would be to go on what I had said earlier, a Part C plan. It's same thing as, it's another name for that is Medicare Advantage. These are plans like HMOs, PPOs, and they usually cover drugs. That is, these type of plans are the ones that you see many, many, many of the TV ads, especially during this time of the year. Insurance companies trying to promote how much more beneficial their plans are. This, again, they are very, very good plans. They have much reduced monthly cost, but they have embedded large dollar amounts of out-of-pocket exposure. A review of each particular plan is very, very necessary. It can be time consuming. So if you are considering a Medicare Advantage plan, I'd give you a little homework. Your first thing would be to contact your primary care physician and any of the specialists that you want to continue to see to determine which of these Medicare Advantage plans they are enrolled in, they are contracted with, because you can easily fall for one of those ads on TV. And when you go to make an appointment with your provider, you learn now that that provider is not in that network. So that is a very important step in considering Medicare Advantage plans. And I'm going to ask, if you do go to see a SHINE counselor for that, to try to get that done ahead of time, because that will take a lot of the onus out of your appointment with the SHINE counselor. They also offer additional benefits. And again, every one of them, there are 41 different plans available by area code, by zip code. So you never know if somebody has in a different area has the same plan as you, again, specific by zip code. Some of them offer flex cards where you can use it for over the counter. Some of them give you dental, vision. There is no one size fits all. They're not all the same. So it does take a lot of time to review each of these individual plans to determine if and when which one of them is going to be good for you. Okay. And again, we can provide more of that information. I have a chart that's going to be coming out with an executive summary of what most of these plans have. But again, finding out first if your provider is in their network. And if that provider is not, you can go, if you buy a PPO, you can go outside of the network with the PPO, but you will pay a higher out-of-pocket co pay than if you went to somebody in the network. Okay. We can go off to the next slide, Pratima. All right. These are the Medigap choices, as I had said earlier. Those are some of the there's 7 providers in Massachusetts that offer 3 levels of supplements. It's called the core, which is the lowest cost, but the lesser of the benefits. There's a supplement 1, which is only available to people now who had turned 65 before January 1st of 2020. It covers everything. You would never get a bill from any provider if you had that plan. The 2025 cost for that plan, I believe, is going up to $262 a month. You still have to have a Part D, a prescription plan on top of that. The level that most people are eligible for, and many of the people who come to SHINE opt for this particular plan, Supplement 1A, and it covers all of the same things. The Part A deductible, it does not cover the Part B deductible, which currently is $240. The core covers the co-pays only, and there's discounts if you join many of these plans, reducing discounts, 15% first year, 10% second year of Medicare, 5% the third year, and then it drops down to whatever. Some of them have a little bit of premiums if you join the plan, and you might get a little bit of a discount if you go paperless. Those are all things that are, again, personal choices, but the basic premiums. The one thing I will note about that is if you do get a list of all of these 7 providers from a SHINE counselor, what you don't have to worry about is looking through and sorting out what has what benefits, because by law, they all have to have exactly the same language in their underlying policies. You don't have to say, does this one have this? Does this one have that? They're all the same underwriting on those policies. What they don't have to have is the same price. So as consumers, we have to make the best choices based on costs for our out-of-pocket coverage, okay? We can go to the next one. All right, again, we've already gone through this open enrollment. This is the one time of year, and welcome. We're in the middle of open enrollment. We're a week into it, 5 days into it. Open enrollment runs October 15th to December 7th. And then January 1st, the coverage for whatever you've chosen during open enrollment begins, okay? Part C, again, reiterate, those are Medicare Advantage plans, and Part D are prescription drugs, okay? So this is the only time of the year that you can just, in general, just change any of these plans that you might have. Okay, we'll go to the next one. Same thing. It's an important time of the year because our situations change, the health needs change, the costs change every year, the providers change their contract, they change the pharmacies that might be considered network. So by reviewing these plans every year, whether you don't think, oh, I don't need to change, you don't know what's going on at the insurance company level. So to review it, just to make certain whatever plan you are currently on is still going to be advisable to be the best plan for the upcoming year. No, that's it. Okay. The Plan Finder tool. Now, this is a Medicare.gov, www.medicare.gov. You set up an account with a username and password. You put in your medicines to make sure that everything is there. And then the system will churn that information by your zip code and your meds to come up with what is going to be the least overall cost for you. Now, some of these things can be very confusing in this first few days, I should say, of open enrollment. There are still a few glitches in the Plan Finder. So again, sending a list of your drugs to a SHINE counselor to help review. If you've got questions, contact the SHINE office to see if they can clarify those questions. But everybody is able to set up their own personal account. So if you do that and you want to do it yourself, this is the website and how to do it. If not, we have a form that you can send to your local SHINE office, and we will run the drug search for you and get back to you with any suggestions of either staying the same or suggesting a better plan for the upcoming year. Okay. Plan finder. This is what the initial screen would look like if you went on there. And if you already have an account, you'd use the login on the far left. If you want to just do what they call a general search and not save it and not set up an online username and password, you would just go into the second one that says Find Plans Now. If and you do that, though, any medicines that you put in there will not be saved. So if you go back to review it, you have to start all over again. So it is suggested that, you create your own account. Okay. We can go to the next slide. This is the information that they would require. So if you are going to do it, have your Medicare card handy. It's going to ask you your Medicare claim number, your last name, your date of birth, when you signed up for Medicare Part A, and then you create your own drug list, compare the cost. And if you want to spend the time doing this, it can be a bit overwhelming at first if you've got a number of medicines to put in there and trying to understand how the calculation. We as SHINE counselors have to relearn it every year because every year they make changes. And sometimes they don't make it user friendly. They may understand what their link is supposed to do, but sometimes it's very difficult for not just the general population, but the SHINE counselors to actually understand exactly what's going on. Some of the information that you see, which may not appear to make full sense on the visual, because there are things going on behind the scenes that we just are not aware of. So please, if you have questions, if you're doing this, if you have questions, don't hesitate to contact the SHINE office. Okay. Medicare Advantage open enrollment. So if you did join a Medicare Advantage plan during this open enrollment plan, or if you've already been on a Medicare Advantage and don't want to change during open enrollment, you have now another window to make a change should that happen. And that's called Medicare Advantage open enrollment. That starts January 1st, but you must have been on a Medicare Advantage plan on December 31st to take advantage of this. You can change one Medicare Advantage to another one, disenroll from Medicare Advantage plans and get a standalone drug plan and go back to Medigap if you want. So the example here is Stephen's PCP. That's the primary care physician, belongs to a medical practice that dropped his Medicare Advantage plan as of February 1st. And that's why I had said, do your homework first. Find out if your primary care physician is still going to be in that network, because if not, you have to pick a new primary care from who's ever enrolled in the network at that time. And as we all know, getting an appointment with the primary care physician can be cumbersome, oh, yes, well, yeah, sure, we'll sign you up, but it'll be 7 months before we can see you. So please, please, please do homework and make sure your primary care physician is still in your Medicare Advantage plan or the one that you're thinking about joining. All right. So Stephen could actually go back. Can we just go back? He can actually go back to a different Medicare Advantage plan if he wants by March 31st, or go back to original Medicare with or without a Medigap and pick a new drug plan. Okay. So be careful of that. Okay. There are special enrollment periods. As usual, there's always some sort of an exception to some rule, and they're very limited. You can enroll or disenroll or change a Part C Medicare Advantage plan or a Part D, but these are the qualifying events. There's probably 15 or 16 of them. Many of them don't apply to individuals, but it all depends on the qualifying event. So if you moved out of an area and your Medicare Advantage plan or your prescription plan is no longer available, you have, I'm going to make the assumption 2 months. So I would have to know what your specific circumstance was to let you know how much time you have to make a change. The prescription, the 5-star plans allow you to change within the year, but right now there are no 5-star plans available. We're waiting to see if there are going to be any coming in 2025. You could also join Prescription Advantage, which I haven't gone into Prescription Advantage yet, but that is a plan out of the state of Massachusetts that helps people defray the cost of medicines during certain phases of their, you've heard of the donut hole and the coverage gap and all that sort of thing. Again, but what it does offer, and it's a free membership, it does offer what they call a SEP. So it's no cost to join. There's a 1-800. You could Google Prescription Advantage. No cost to join, but it would give you a special enrollment period no matter what, at least for one time during the year to change your plan. And that's a big benefit. That's a big benefit. Or if you have a program called Extra Help, that gives you a special enrollment period. But anything else, you need to call a SHINE counselor and see if your qualifying event is covered under a special enrollment period. They're hard to come by. Okay. Next, please. All right. Changes in Medicare Part D. And this is where we are all in a learning curve right now. These were changes that were put into Medicare due to the Inflation Reduction Act of 2022. It eliminated what they call the donut hole or the coverage gap, which is, if anybody who's been in it, you know that when you hit the donut hole, you have a higher cost for your medicines than you had prior to that. I think it was $4,000 for the year, and then you went into catastrophic after that. But they've eliminated those 2 phases. Okay. Now there is a new annual out-of-pocket spending cap of $2,000 for Part D beneficiaries. That means that even if you're on some very expensive medicines, you will pay no more than $2,000 for that medicine over the course of over the year. And this is where I had said, if you are going on to that plan finder and you're seeing these numbers and you don't understand them, it's basically based on this particular caveat of the plan, the $2,000. There are some people who would hit the $2,000 if they had a very expensive med, maybe in January, February, March, depending on when you'd be able to see when you're hitting that $2,000 cap. There's also the introduction of a Medicare prescription payment plan. And that is another bit of confusion when you're on the plan finder, both for SHINE counselors, because we're learning how it all works behind the scenes as well. And from all of the examples that I have done so far, it appears to me that if somebody is going to go to the pharmacy early in the year, and it's going to cost them $2,000 for their medicine, that joining that prescription payment plan may be beneficial because it would smooth out that $2,000 and pay it over 12 months and not just all up front at the pharmacy. Each case would need to be reviewed individually. Again, before I make any jump, everybody should join this program. It is run, each one of the Medicare Part D insurance companies has to offer this plan. But, and again, I get a little bit concerned for the consumers, because if you join a plan that's costing you $107 a month, that's your premium, and your medicines are going to cost you $2,000. You are going to get a separate bill from the insurance company for your 1/12 of that $2,000. So you're going to get two bills from an insurance company. So I don't know logistically how that helps. But again, on an individual basis, reviewed with a SHINE counselor to help determine if that payment plan is going to work for you. And again, I don't know the details behind it. So my concerns, and I don't know if I should be voicing them here on this, is if I'm getting two bills from an insurance company and I don't pay the prescription plan bill and it goes another month, now I've got 2 months of bills that I have to pay. And if I don't, they're going to drop me from the plan. And because this is so new, I don't have the experience of what happens if it doesn't work smoothly. I don't want to see consumers get themselves in a financial hardship because you've got multiple bills coming in. So I would really encourage everybody, again, to speak with the SHINE counselor to determine if getting into this type of payment plan is really going to help you or not. So I don't want to see people jumping into what I call debt if I'm going to be getting bills monthly from an insurance company on top of my premiums. So please, that's my main concern here. I haven't seen it work yet. So I really hesitate to jump into it. Okay. It may be the perfect thing for many individuals, but I'd have to look at that personally one-on-one before I make a blanket statement. Okay.
I have a quick question. I got
Sure.
a text from a person like he said that someone came to my mom's door and tried to get her to sign up for Medicare Advantage plan from a specific company. Is that legal?
They can do what they want to do. Yes. Should it be happening? Is it morally or ethically in my purview? No.
Yeah,
No. They get paid a lot of money commission to sell those plans.
exactly. And then there's another question, Kathleen. Like, what's the deal with the $0 premium Medicare Advantage plans? Are they really free?
No, they're not really free. You still pay your Part B premium, which is currently $174.70. Okay. And you don't pay any additional monthly fee. But what you do is you pay for services as you use them. So if you don't have any chronic medical issues or you haven't you're not utilizing doctors and specialists and hospitals, x-rays and emergency rooms, it can be financially a good choice. But if you have chronic illness and you have to be hospitalized or you need CAT scans or you need more assistance than a healthy individual, those plans, and again, they range from zero premium with out-of-pocket exposure of some of them up to $9,000. So you have to look individually, again, your primary care physician, your specialist, because if the specialist is out of the network, you're going to pay higher. So every time you use a service, you have a copay. You have a co-insurance. Many of them have changed right now. If you are to be hospitalized, and many of them say you're going to pay the $335 a day for the first 7 days. So that's $1,500. So is your premium really free? No, it's the out-of-pocket exposure that you're buying for not having a monthly premium.
Correct.
I liken that for people to understand what I'm trying to say, because health insurance to us is an emotional issue. We all want to feel safe with our health insurance. It's an emotional. But in the world of business, just like this fellow knocking on the door trying to sell something, it is a product.
Yeah.
It's a product and it's a business. It's a product. Now, if you bought my example that I use is if you bought yourself a new Lexus and you went to the insurance company and they said to you, "Oh, you don't have to give us any premium for your insurance." What do you think they're going to do when you go back and say, "I totaled my Lexus"? They're they're not going to feel sympathy for you. They'll, "Oh, that's too bad. You didn't pay us anything," you know? So in my opinion, and I'm unbiased, they are good plans when they work, but I do not recommend them for people who have chronic illness, because you use those services over and over again, and it can be very, very costly.
So Kathleen, we can say that when comparing plans for the person they care, it's important for them to look into or look at the overall estimate
Yes.
how much they will pay out.
Yes. And what I can do, Pachima, is I will forward you when I get it, the plans available in, you're in Norfolk County mostly, right?
I'm in Bristol County.
Bristol County. I will
But
send
the
you.
people are all over. They're in Norfolk, they're in Middlesex. Yeah.
So I will send you the charts so that somebody can see them at another presentation or whatever you might do of what those out-of-pocket costs could be. Okay.
Bottom line is there is no one solution for all the people.
No.
Everybody has to consider their own situation and also which one you are prepared. You want to prepare to pay as you go, or you want to pay something safe and forget about the rest of the year. These are the two kind of decisions one has to take based on situation. Okay.
True. Yeah.
Thank you.
Do you want me to go to the next one? Yeah.
Please. Again, I don't want to go too deep into this on a general consensus because I think it's very confusing. It's a brand new plan. It's the way to smooth out a cash flow for your prescriptions, but I don't have any specifics. I haven't seen it work yet. I don't know how it's going to affect a consumer. My concern is, like I said, to me, a payment plan is going into debt. And I don't want to push people into debt. That's, to me, I understand that you have this exposure, you have this cost, but I don't like monthly bills installments for your medicine. It's my own personal. It may work for certain individuals, but it's not my personal choice because I'm unsure how a big insurance company is going to send a bill to somebody, and let's say you send a check back and it gets lost, it gets missed in the mail, and now you get a bill for 2 months. And what happens if they do it from a checking account and you don't have enough in the checking account on that day? So I envision the worst. I'm assuming that this plan envisions the easiest, the best solution for some people, but I really don't know in the consumers that we reach mostly in the SHINE offices if they have that type of ability. So I am very uncomfortable in recommending this plan without a real individual check and balance on somebody's account. It's too new. It's too new. There are other programs that I'm much more comfortable in getting people involved in and speaking to them about, and that is other coverage that can help defray the cost of some of their Medicare and their drugs. Mass Health is one of them. The federal program is Medicaid, but in Mass Health, it's Mass Health. There are any number of different programs within the Mass Health family of programs. So when you hear somebody say, "I have Mass Health," you really don't know what particular program they might be on. So there are full health insurances. There are some that just pay for premiums. There are some eligible for people who want to stay home. There should be in a nursing home. There's plans for disabled individuals. So again, as with everything else, as Madrid had said earlier, it's all individual. So again, we can review somebody's needs and recommend what Mass Health program they would or should be on. There's a new program called Medicare Savings Program, which I think is a fabulous program. Many people will be eligible. It's based on income, and I can send that particular program along to you, Patrima, if somebody's looking for that specifically. And there are 3 levels of that based on income. If somebody's income is a couple, I think it's 3824, I believe, they could benefit from one of those type of programs within there. The most inclusive pays for the Part B premium. It pays for co-pays, deductibles, co-insurance. It provides extra help for prescription coverage. So that is something that I recommend a lot of people review. And it's opened up to many more new individuals because they have actually removed the asset limit. It doesn't matter if you've got $1 million stuffed in your mattress. It's only income based, the eligibility. So everybody should review that. Send in the very simple 1-page application. Mass Health will say you're eligible for which level of these programs. There's a benefit to all of them. The most beneficial is called the Quimby. We can go, that would take another whole presentation, Pratima, to go into that, okay? And that is when I do go to that health fair, I will have that information. That would be one of the handouts that I will have available for that. The explanation, who's eligible, the application, and what to do if you do get enrolled. So I'll have that with me, okay?
Kathleen, this question that what if I plan to work past 65?
If you plan to work past 65 and you are on a group health insurance, there's nothing you have to do. You could, if you want, apply for Medicare Part A because there's mostly no premium for that, and it gives you a little bit of exposure into how to get into the system. But there's not anything if you're on group health insurance, you don't have to. Now, on top of that, depending on the cost of your group insurance, you might want to consider going on Medicare, full Medicare. But that's a comparison of what it's actually costing you. So let's just say, for an example, I said earlier that for $400 maybe to $450 a month, you could be fully covered. So if you're looking at your employer group coverage and you're paying $175 every 2 weeks out of your pay, you're up to almost $400. And then if you have a high deductible plan where you've got to pay the first $3,000 or $4,000 of your medical, going on Medicare may be a good alternative. But if you've got family members that are depending on you on your group coverage, everything is looked at individually.
Correct.
Okay.
Yeah, really helps. Yeah.
Extra Help is a program that helps with prescription plans. There are a limited number of plans that accept Extra Help, but if you do end up on that, the most that any pharmacy can charge you to pick up a medicine is $11.20. And again, if you on that Medicare savings program, you are automatically enrolled in Extra Help. So again, when I'm at that health fair, I will have all of that explanation, and it will be beneficial to a lot of people. Other than that, for some of them,
Kathleen, sorry to disturb you. That one,
Yep.
like what happens if they make a mistake? So we can always tell that if you make a mistake, you can pick a different plan by December 7th deadline. The new plan will be effect on January 1st.
Correct. So if you enroll in one today and it's not the right one, and you enroll in a different one next week, and then you say, oh, that's not, up until December 7th, whatever is on the plan finder for your enrollment on December 7th is the one that you're going to get. Okay. If it's a drug plan. If it is a Medicare Advantage plan and you realize in January that it's not the right plan, you're now in Medicare Advantage open enrollment, and you can change that and go back to another Medicare Advantage, original Medicare, and then pick a new drug plan, a standalone drug plan. But if you pick a drug plan, it is good. You're enrolled as of January 1st, and without a special enrollment exception, you're on that plan for the year.
Got
Manufacturers also give assistance, for income qualifiers for some of their very expensive drugs. And you went by fast, and I didn't see what that last line was. And coupons are good. RX coupons, they're good, but you cannot use a good RX coupon in conjunction with the Medicare Part D plan or a prescription plan on a Medicare Advantage, only separate from any Medicare plan. But you can go Google all kinds of coupons. There's all kinds of coupons out there now. And again, SHINE counselors can help screen for all of those different programs. Okay.
I'll do the next one. Yeah.
Yes, please.
That's for the next one. Yeah.
Yeah. Okay, so for people who are under 65, who have been on Health Connector plans, you can no longer stay on a Health Connector plan unless you are eligible, unless you have to pay for Part A. If you are on a Health Connector plan and you're eligible for premium for Part A, which means you've worked the 40 credits, you cannot stay on a Health Connector plan. You need to sign up for Medicare. You'll lose your Health Connector coverage. You lose any tax credits that you're receiving. And if you don't sign up for Medicare, you can be subject to the late enrollment penalty. If you are eligible, if you are not eligible for premium free Part A, which means you haven't worked your 10 years within the Social Security and you have to pay for Part A, you can keep your Health Connector plan. But I'm going to tell you that it's been my experience that people on Health Connector who turn 65 and don't realize that they should have gone on to Medicare, they still may get a bill from their Health Connector plan, even though they're no longer going to be covered. So it's up to the consumer to make sure they actually cancel the Health Connector plan. Otherwise, they're going to pay the Health Connector plan premium. And then if they had to use it, would not have coverage, they'd be rejected anyway. So it's important to make sure that you understand that.
And then they lose tax benefits.
Yes, you use the tax credits to pay the premium for your Health Connector plan. You won't get it any longer.
Sure.
All right, so what have we got? Let's see. Oh, these are the rules, that the protections that CMS, which means Center for Medicare Services, and Medicare Advantage plans, strict marketing guidelines. And this will go back to your knock on the door, Pratima. Brokers and agents cannot use high pressure tactics, and they must obtain consent before discussing plans and cannot provide misleading information. All right. The scope of an appointment: agents must have consumers sign a form outlining what can be discussed during their sales meeting. So if somebody opened the door and let them in, there should be a form that they sign to say, okay, I've let this fellow in to discuss the plan. Agents must separate educational events from sales events, and no sale pitches are allowed at educational events. That's pretty hard for salespeople to do. Everything's always a little bit of a sales tactic. And the enrollment safeguards. Consumers now have a cooling off period to cancel the enrollments and can switch plans during the open enrollment. We've already discussed that, or through a special enrollment period if they find one that they're eligible for. You have a right to appeal the consumer. You can put in a complaint, and I actually have the forms in office to do that. But what I need in order to actually file a complaint that is going to get any kind of attention is the name of the person who was the sales rep. If you just say the guy came to my door from such and such, they won't even accept the complaint from me. So you need the name, the date, phone number if possible, how many times they called. They need real information to actually accept a complaint. Okay. Takeaway. Don't miss the deadlines to sign up for Medicare. That's the 7-month window that you have there. And there's other deadlines if you're still working, but that would mean a SHINE appointment to go over all of that specifically to the individual. Contact Social Security to find out if you've made your 40 quarters. If you're turning 65, you'll be eligible for the part premium-free Part A, and you have to call the Health Connector to disenroll. Receiving SSDI, we mentioned, will be automatically enrolled in Medicare after 24 months. Make sure your doctors and hospitals are in the network for the Medicare health plan that you're choosing. Be sure that you have your current medications listed on that Part D formulary to run a true search. And remember to review your Medicare plans every year during the open enrollment. Every year runs October 15th to December 7th. Where to go for help? Social Security, these are the guidelines. Medicare directly, the pharmacy outreach. And the pharmacy outreach is through Mass College of Pharmacy, and that is really good. If I get a consumer in here who gives me a list of medications, I'm not a pharmacist. So it can be overwhelming, especially if somebody's on sometimes 12, 15, 20 different meds. I usually refer those particular consumers to the Mass College of Pharmacy. They do an outreach program there to determine the medicines that an individual on, help make suggestions to maybe change a medicine. Because what happens in many, especially some of our older consumers that come, if a doctor 2 years ago prescribed them a particular meds, they keep getting it refilled because it's got the refills, but they may not even be on that medicine, should not be on that medicine anymore. So when it gets really complicated, I recommend that people go to the Mass College of Pharmacy to review the full extent of the medicines and how they interact with each other. Again, that's beyond the capacity of most of the SHINE counselors. We do have a few, and Badrid is not good enough to have the experience of working with one of our retired pharmacists, so he's got a little bit of an in there. But that is very important, okay? SHINE counselors are volunteers. We're not pharmacists. We don't really know. We can't make suggestions. Prescription Advantage is the program that I spoke about earlier on. It's a free to join, and it does help defray the costs of medicines if it's applicable. But with this new $2,000 cap, it is not as advantageous. But what it does do is provide an individual with the special enrollment period, no matter what, once a year to make a change. So I really believe that everybody should have that membership card in their pocket should something change throughout the course of the year. The 800 number for SHINE is a state number, and the state would get the call, and then they would send it back to whatever region the individual lives in to actually contact the consumer. So if you want to put the HESCO SHINE office, if that's a specific number, so that you're not getting pushed around from one 800 number to another 800 number, the HESCO office in Walpole is the regional office for the SHINE program in this area. That number, 781-784-4944, and you leave a voice message on the volunteer line, extension 254. Okay?
Yeah, that's wonderful. I think they're going to get more questions, and I will ask them to
Oh, yeah.
mail it, so because we can show to Badrinath Gaur, Badrinath ji can
Mhm.
and
Yep.
also he can get back to them. But here I would like to say thank you so much, Kathleen, for that.
You're welcome. All right.
presentation. And I
Okay.
say that you have given all the people who will be watching it eventually, given us a clearer understanding on how to navigate Medicare open enrollment by selecting the right options, and they will select. To everyone who will be joining us through recording, and I would like to thank for your time and engagement. And as a reminder, today's session will be recorded and is recorded, and we will be sharing the recording with you all soon. So feel free to review it and share it with others who might benefit. And for any other questions, additional questions, or need further assistance, please don't hesitate to reach out to the local SHINE counselor. The one is with the Walpole, and you can connect with us if you want to know their number and extension. Stay in touch
Perfect.
and make most of this enrollment period. Thank you again. Have a wonderful